Good day! So I am Valerie Cornel Tadran, Group 4 from BS1F of Polytechnic State University of Bicol. And today I'm going to do my return demonstrations on administering intramuscular injection. So for the assessment, we need first to assess the client's allergies to the medications and also the specific drug actions, the side effects, and the adverse effect, and the client's knowledge and the learning needs, and also the tissues integrity of the selected site, and also assess the age and weight of the patient, for what kind of needle will be used, and also the client's cooperation. Next is to determine. So we need to determine the muscles will be used. So here I will be using the deltoid muscles. So the capacities of the deltoid muscles is only 1 to 2 ml of the medications. Okay, next is gather the equipment. So the equipment that I'm going to use, of course, do not forget to bring the MAR or the printout, and then our sterile medication here. So I will be, since it is only 1 to 2 ml, so I'll be using the 3 cc, and then it has this 23 gauge here, and then do not forget to bring the antiseptic swabs and clean labs according to the agency protocol. And next one is the medication. So here I will be using the vial hepatitis B vaccine. And next is to check the MAR. So I have MAR with me. So we need to check the label here, okay, the medication carefully against the MAR to make sure that the correct medication is being prepared, and then follow the 3 checks. So the manufacture date, the dosage, and also the expiration date. Okay, then read the label on the medication before withdrawing and after withdrawing the medication, and also confirm that the dose is correct. And next is organize the equipment. So we need to organize our equipment. And after organizing the equipment, we need to provide the hand hygiene, so hand washing and or sanitizing and donning of gloves depends on the agency protocol. Next is provide for the client's privacy. So upon entering on the client's door, do not forget to close the door and the windows for the privacy. And next is prepare the client. So introduce yourself. Alright, so hello ma'am, I am Valerie Duran, your nurse for today. Alright, for verification only, can you please state your name and your surname, your first name, and your middle name, along po ng age po and your birthday po.
Okay, I'm Jessa May Hanovo Balbana, 19 years old. I was born July 26, 2002.
Alright, so thank you very much. Alright, so just okay. So next is assist the client on the appropriate position, since I will be doing the deltoid injections on the intramuscular injections. So here in the deltoid muscle, so the appropriate position is a sitting position for my patient. Okay. Next is explain the purpose of the medications and how it will help using the language that my patients prefer. Alright, in explaining po the procedure, what kind of language do you prefer po? Is it Tagalog or English po?
Both po.
Okay, so thank you for both po. Alright, so sa ating procedure po, no? So we'll be doing the intramuscular injection po, meaning po mag-inject po ako sa inyong shoulder, alright? So ito po ay sa Hepa B po, no? Hepa B vaccine. So, dito po sa Hepa B vaccine, may effects po siya, no? Pwede pong magkaroon ng soreness or redness po sa pinag-injection po, alright? And then, pwede ka din po magkaroon ng fever, ayan, and also fever and headache po, alright? Yun lang po ang mga common symptoms. So, ito naman pong Hepa B, no? Makakatulong po ito sa pag-boost ng immune system niyan, alright? Okay, so, ito po ay first dose pa lamang po, opo. Okay, meron ka pa pong ilang dose pa po, alright? Okay. Okay, ma'am. So, I'm going to select and locate and clean the site po, alright? So, I'm going to select a site free of skin lesions, tenderness, swelling, and hardness. So, does it have any pain here, ma'am? Wala po, no?
Wala po.
Okay. So, nagkaroon ka po ba ng vaccines dito sa site na to? Hindi po.
Hindi pa po.
Okay, thank you. So, If injections are to be frequent, alternate sites, so avoid using the same site twice in a row. So locate the exact site for the injection. Here I'm going to locate a chromium process, so 2 fingers here and 2, so it's right here. Okay, and then after locating, so put on a clean gloves, so first and then gloves. Okay, so after putting the gloves and after locating, we're going to clean the site po with our antiseptic swabs. Okay, so using circular motions, start at the center and move outward about 5 cm to 2 inches. Okay. Okay, thank you. And then transfer and hold the swab between the third and fourth fingers. Okay. And then position the swab on the spine skin above the intended site. Allow the skin to dry prior to injection on the medication. Okay, let it dry. Alright, seems that it is dry. While waiting for it to dry, prepare the syringe for injection. So remove the needle cover and discard without contaminating the needle. Okay, if using a pre-filled unit dose medications, take precautions to avoid dripping medications on the needles prior to injection. And if this does occur, with the medications off the needle with a sterile gauze. Alright? Okay. And then, after preparing, we're going to inject the medication using a Z-track technique. So using the ulnar side of the non-dominant hand, we're going to pull the skin approximately 2.5 cm and 1 inch to the side. And then, hold the syringe between the thumb and forefinger here, and pierce the skin quickly and smooth at the 90-degree angle. Insert the needle into the muscle. Okay, ma'am, going to inject na po. Alright. Alright, and then hold the barrel at the syringe steady with your non-dominant hand. Okay. Here, hold the barrel and then aspirate. Okay. And then, if I don't notice any blood when I aspirate, then it is ready to inject. And if the blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. Okay? And if blood does not appear, then inject the medication steadily and slowly, approximately 10 seconds per millimeter, while holding the syringe steady. Okay, so every millimeter, alright? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then just in your mind, count 1. Alright. And then, after the injection, wait 10 seconds. Alright, wait 10 seconds. Then withdraw the needle smoothly at the same angle insertion. Release the skin. Okay. Discard. And then, apply gentle pressure at the site with the dry sponge. If bleeding occurs, apply a pressure with the dry and sterilized gauze until it stops. So in discarding this one, we're going to activate the needle device if it has, and discard the uncapped needle and attach syringe into the proper receptacle. Okay, so after doing that, okay, thank you, ma'am. Okay, does it hurt, ma'am? No? No, just a little. Alright. And then after that, to remove the gloves, perform hand hygiene. Alright? Okay. Move hand washing or sanitizing. And then, take care of all of the equipment. Dispose all of the syringes used and the swabs. So thank you, ma'am. And after all of the procedures, do not forget to document all of the relevant data. So the dosage and the time and the route of administration. Okay. And also the client's reactions about the medications. And after that, assess the effectiveness of the medication. That is marathon demonstrations on administering intramuscular injections. So thank you for watching.